the following situations is most appropriate for the nurse to apply an elastic bandage? Thanks. So what are you thinking of when you see an elastic bandage? A Band-Aid? I don't think we talked too much about using Band-Aids. Okay, yes. So an elastic bandage is something like a Kerlix dressing. If you opened up your sterile dressing kit at home, there's a stretch roller gauze in there, and that's kind of what we're talking about. Um, so, okay, yeah, now that you're thinking about it that way, okay, good. What you're going to use that for
I'm a
is,
little to the party, but I choose C. C.
okay,
Thank you.
so if you've got a dressing on the forearm and maybe that's a hard area to tape, or you don't want to put a lot of tape on the skin, you can wrap an elastic bandage around the dressing and then tape on the gauze of the elastic bandage. So that is mentioned on page 770. It talks about securing dressings. To keep a chest dressing or an abdominal incision intact, you would not wrap the patient in gauze or Kerlix. You would use what? What would you use for A and B? Yes, Barb, an abdominal binder. Good. And that's more of a piece of fabric that is stretchy and provides support. To keep a wound vac in place, D, that is its own special dressing, and it's usually just kept in place with a clear, transparent type Tegaderm dressing. Okay, good. Match these up on your own. So what is a non-adherent pad? Which one matches that? That's kind of Good. It's a shiny material. Good. And I know this is really hard that you guys haven't been able to see these in person,
I choose
but
4.
okay. Yes. So this a dressing that's not urine is good for a skin tear or an abrasion to protect it. It doesn't have a lot of absorbency to it. So, and these wounds don't really drain a lot anyway because they're pretty superficial versus maybe skipping down and a dressing such as an ABD pad would be used for what?
Excessive
Good.
drainage. Mm.
Yeah, for wounds that are having more drainage or exudate.
I
What
pick
about a
C.
what about a tegaderm or a transparent dressing? What is that
The
match?
second one, the clear film.
Good. The clear film that you can use to just protect a wound. It has no absorbency to it. It's literally like, I don't know, just a just
I'm
something you
not
would
sure if
see put
this is
over like
right, but I pick the
Mhm.
clear film one for this one.
Good. Stage 1 or stage 2 that'll protect. Maybe a very superficial stage 2 or a stage 1. And then the last one that matches the top one. You can use it for wet to damp dressings or for closed incisions, such as what you're going to use for your sterile wound demonstration or to pack a wound. Good. Okay. Match these up. These are the different types of debridement. So sharp matches number 2. Good. So what is debridement? What do we mean by that? What do you remove?
Necrotic skin.
Yeah, necrotic tissue, dead tissue. So if the wound is infected, you need to get that off of there. I say you, but it's not really the nurse. But the patient needs to get that removed ASAP. So that is done with sharp, like a scalpel or a surgical tool, and it's done in an operating room setting, or it could be done in the patient's room, perhaps. But it's immediate. You get your results immediately. enzymatic de- enzymatic debridement. What do you think enzymatic debridement is? Number 1, you're using a topical solution or some sort of cream, applying it to the wound and break down the necrotic tissue. Great. What about which one is mechanical versus autolytic? Feel free to talk. We love to hear your voice.
Is the mechanical one, the mechanical debridement, is that the wound irrigation? Irrigating
Correct.
mechanical debridement?
Yes. So mechanical is when you would irrigate the wound, maybe have a hydrotherapy like whirlpool treatment, not necessarily recommended for infected wounds because it does take longer. Again, you want to help resolve that infection ASAP before it leads to a systemic infection. And then so autolytic would match number 3. Autolytic is the longest amount of time to break down the necrotic tissue. Oh, good. Okay, cool. That seems to be good. Um, questions on pressure ulcer topic, content, I should say, before looking at some questions for the other two topics. Anything else from yesterday? Yeah, Barb.
Wondered if we could go over those online scenarios a little bit.
Sure. So I posted the answers for the sterile wound handouts, and then tonight I'm going to be posting the answers for the pressure ulcer one. Sorry, it
Okay.
takes like longer to make the answer key than it does to come up with the scenarios. And these are all things that we normally would just talk through in class, and now we have to write it out and post it. So hopefully after seeing the handout answers, that'll help. And then if there are additional questions, shoot me an email, or we'll talk about them maybe tomorrow or at a different discussion. I don't know if we'll have time to get through them today.
Okay.
Yeah, thanks. I will be posting that. Okay, let's talk a little bit about bowel ostomy. Check this question out. See what you think. Thanks. Any other answers? All right, so mostly A and a couple B. So I'm really glad that you all chose, or I shouldn't say all, but a lot of you chose A, or the majority, because that's the correct answer. So after abdominal surgery, the patient's complaining of feeling bloated and distended and painful. What are you going to do next? Most importantly, you do want to notify somebody, because so you want to notify someone, because they need than just B, C, and D. D, you don't have to tell them to, only have clear liquids. They need more help than going for a walk. And although, sometimes we do that to encourage having a bowel movement and stuff. But, and then their stool softener, that's going to help soften the stool, but it's not going to help take care of their digestion and bloating. So after you consult with a surgeon on the previous client, which of the following enemas will you prepare to administer? All right, so we're seeing some A's. What other answers can you get? Okay, I'm seeing B. Not enough information. So the patient is complaining about bloating and abdominal distension. This is talking about the previous client. So here, let's go back to look at the situation. They're feeling distended and bloated. So with that being said, I'm just trying to find that page number for you guys about the different types of enemas. 580 to 581, it talks about different types of enemas. So do these. Okay. So the patient into the touch, painful to palpation, feeling bloated and distended. So technically what I was looking for was for you to recognize that this was distension reduction enema. So to help relieve discomfort from flatus or excess air causing distension of the patient's abdomen. So that would be a carminative type enema, also known as a distension reduction enema. When would you use soap suds and tap water? Technically fall both under cleansing enemas. When would you use those?
Surgery.
You will use
Prepping
those
them for
before
surgery.
surgery.
Okay. Good. And then oil retention is used mostly in what situation?
Is the oil when used like when they're like really impacted?
Yeah, when there's a lot of hardened stool there.
Yeah.
Good, because that helps soften it up. So different types of enemas are on 581. So take a look at that. What here? Take a Any other guesses? Okay, so the majority chose C. For those of you who chose C, why did you choose that over the other answers? Because it's the correct answer. So why?
I picked C because the other answers are like normal findings.
Great. Right. So A is a normal finding. It is usually just protruding slightly out from the abdomen. And it shouldn't be purple. It's abnormal. Good. Immediately after taking the faceplate off or the appliance, it makes me just a little irritated but by the time you know, measure it and cut it and clean everything, that will generally go away, and it's not a cause for concern, and it's certainly not something you're going to report provider motor brief redness. Change in the stoma color is what you are going to report C. And then the fact that D, the ascending colostomy delivers liquid feces, that's generally, yeah, like right after the ileostomy, you go into the ascending colostomy, that stool is not yet formed. So it is normal to have more liquid feces coming out of an colostomy on the left side or ascending area. So good. You want it to be, as Jackie said, bright red and rosy. I should say. All right, last one on ostomy stuff. Any other answers? All right, good. So for those of you who chose C again, why did you choose C instead of A, B, or D?
Is it supposed to be 1/4 an inch, not 1/2?
Correct. That's the difference. It's supposed to only be 1/4 inch. The opening of this appliance, I should say, is only supposed to be 1/4 inch larger than a stoma site. Yep, a 1/2 inch is too big. And what happens if there's too much
You're gonna cause the
room?
skin to break down.
Exactly. Good. Emptying the pouch when it's a third to half full is correct. Changing the pouch every 3 to 5 days is correct. And then just keeping the skin around the stoma clean and dry is correct. So good job. Questions on any of that? Does that seem okay?
I almost picked B because some of these wordings can be a little tricky.
Mm-hmm.
Because it would lead you to think you're only supposed to empty it every 3 to 5 days, but you're talking about changing the whole appliance.
Right. Yeah. If we want you to focus on emptying, we'll say empty like A, and then changing the system is actually taking it off.
We got to get used to NCLEX style questions because they play too much.
Yeah, I
And if
mean,
you
you don't want to go through this whole program and not be successful in NCLEX, right? So NCLEX questions, a lot of these I have found, you know, just for practice and stuff, I've found on the internet. I mean, they're all out there. So I know you're busy right now, but in May, things will start to slow down after finals and stuff. So continue to keep up on doing NCLEX questions, okay? Oh, sorry. Last, oh, yeah. I mean, you can just Google them too. And you'll come up with free questions.
Awesome.
But yeah, we can try to pull some together by the end of the semester. I know no one's going to work on it probably right now. What about this one? Providing diet teaching. Come on, other 9 people. Who else is out there to answer this question? All right, good. So it's a little split between B and D. So let's talk about those. So you do want them to avoid the overwhelming, choice would be B, things with corn, seeds, popcorn, nuts. All of those may cause what?
Obstruction.
Right. So, um, so they don't have a lot of carbonated or caffeinated drinks because they can increase the intestinal activity, but a little bit could be fine. And steamed broccoli, they say raw vegetables and fruits are, to be avoided. So a cooked vegetable may not be as bad, and the meat thing is fine. So yeah, the answers are designed, right, to have you debate between these 2 answers. And you have to look at which one is most correct. Oh, good. Okay, just a couple on kind of like keeping in mind the principles of sterility. And this one's kind of a combination with the whole pressure ulcer / wound topic. Couple more people yet. Just what do you think? Couple more. Come on. What do you think? Okay, for the sake of time, look, it's a mixed bag, but B was overwhelmed. The overarching correct answer, and that is correct. So let's talk about that. How come you tell us, for those of you who chose B, why did you choose B over the other one?
Because B, you don't need a mask for MRSA. That's um, like a contact
Right.
precaution.
Yeah, and this is bringing it back a little bit, I know from earlier in the semester. Oops, yeah, contact. So MRSA's and contact precautions. So you do not necessarily need a mask. Good. And I know everyone's super hyper about the mask right now. So I was like, when I found this question, I was like, well, let's try it and see what you do. So I just wanted to highlight though some of the other answers real quick. So A, you do want to measure about once a week. Okay, so that is correct. And that should be an order that you have, or it should just be a nursing intervention that you do at your place of employment. It is a good idea to restrict visitors. I mean, it doesn't say that they don't allow visitors at all, but while someone has an infection, generally, we don't want a lot of people visiting if possible. And then, of course, you do want to educate the patient on how to promote skin integrity. Did the question itself, which of the following orders will the nurse question or ask for clarification? Did that trip anybody up?
Yes.
Okay, because we're saying here, which one do you feel is incorrect? Which order? So just make sure to really read the question carefully.
I call those kind inside out questions.
And again, we put them up here because you'll see them on the NCLEX. It's not that we're trying to be, we want to prepare. So the answer was B. If you had a client with a MRSA infected pressure ulcer, if I saw the order that said don a mask when patient's dressing, I would ask why. That's more or less what this situation is saying. Why do I need to do that or whatever? That's, And the point of the question is to also have you look at the other answers and identify some of the things that we talked about, such as measuring the wound once a week was one of the things that we did talk about. And what about a wound measurement? Are you just measuring one part of the wound, or what parts of the wound are you measuring?
Width and length.
Good. Width, length, and one more. The depth.
Deafness.
Good. Yeah, good. Awesome. All right, last one. All right. Good. So majority chose D. So let's talk about that. And glad that you all feel that the outer 1 inch of the sterile field is considered contaminated. So you can touch that with what? You can touch the outer edge of or the corners of a sterile field with either your bare hands or your sterile gloves. Clean, right? Bare hands, awesome, but not your gloves. Cool. Keeping splashes on the sterile field to a minimum. We don't want to have any splashes on the sterile field. So not even a minimum amount. Any amount is considered contaminated now. Certainly you don't want to cover your nose with your gloved hand when you sneeze, because now you're contaminated. And you do not have to soak a forceps in a disinfectant before using it. They would come sterile for you if you are using those. So good. I'm glad that that principle of keeping that 1 inch border is fresh in your mind. That's all the review questions I put together for now. If you want, I can post this PowerPoint and the recording. And otherwise, check out the handouts that we have posted for you on Blackboard. Again, I'll get the answer keys up for the pressure ulcer ones tonight. But otherwise, the bowel ostomy, the sterile wound, and all